Welcome back again for the second class. So in the first class we were talking about the goals, and I think we have had a detailed discussion about the goals of ACL rehabilitation. Now coming back to the rehabilitation, as we were discussing in the classroom also, that in the day 1, day 2, day 3 it's all about the pain and swelling management. So you can see that I have marked up here in the week 1, starting with the icing and basically pain reduction. This is a very brief points which I have added up compared to our classroom discussion. So here you can see that icing is the very first thing, and elevation which used to reduce the swelling. And the goal in the first week is basically to get 70 degree of flexion at least minimum by the end of the first week. Additionally, there will be some knee braces which I will talk in the next classes. Starting within the first week also, we can start up with the patella mobilization, which should continue at least for the 8 weeks. As you can see in this point, that is, it should continue for the 8 weeks. As soon as the day 3, day 4 comes, as I have discussed in the classroom also, that we should focus in the strengthening exercises of calf muscles, hamstring and quadriceps, especially the vastus medialis can be performed. Coming back to the week 3 and week 4, as we all know that in the first week it's all about pain management, starting a little bit of muscle also in the week 1. Coming back to the week 3 and week 4, it's all about taking responsibility by the muscle. So if the muscles are working, what we should be doing is let the person walk. Okay, so the patient must try to genuinely increase the stance phase in an attempt to walk with one crutch, and with good hamstring and quadriceps control, the use of crutches can be reduced earlier. So use of crutches can be reduced earlier. This is a very important point. So from here you can think of reducing it to the single crutch, and the single crutch can also later on reduce down to independent walking. Okay, so this is the guidelines, not as a protocol. Coming down to week 5, as you can see that even though stopping the knee brace, we are not stopping the knee belts or the knee range of motion braces, which I will show you in this way. This one. So this one I was talking about. This is a knee ROM brace. So you can see there are 2 metal strong plates over here, so which will allow a 70 degree, 90 degree or 100 degree of flexion in this way. So you can stop it even at this degree also. So wherever you want it to stop, you can stop it there. So coming back again, so in the slowly we should target to remove that also. And how we can remove that is by getting a good control in the hamstring and quadriceps. So all the isotonic exercises of hamstring and quadriceps should be bringing up till week 5 and week 10. So all the independent exercises, all the resistance exercises, all the isotonic exercises should be included in this week from week 5 to week 10.